Hi, everyone. Welcome to our broadcast. It's great to be with you. My name is Kenya Beckman. I'm the Regional Chief Philanthropy Officer for Southern California for Providence, and I am the co-lead for our health equity efforts along with Jeremy Elkins, who, when he's not bumming around with me, is leading our government programs as the Director of Government Programs for Southern California through Providence. So we're both excited to be here with two people we admire a lot and are working with very closely on health equity. We're going to be introducing you to Andrew Suggs, who is the founder of Live Chair Health, and to Dr. Stephen Noble, who's the lead medical advisor for Live Chair Health and has been with the company from the very beginning. These are two amazing leaders that you need to know about and that we're excited to partner with on behalf of health equity and behalf of Providence in Southern California. So we're going to get started here really soon. If you have any questions, drop those in whatever channel you're watching, and we'll try to grab those and incorporate them. But even though you're going to learn a lot of great information today, I'd be remiss not to tell you that this is for informational purposes only. It's not intended to be a substitute for professional medical advice. It's not meant to diagnose you or give you treatment, just to enjoy and to learn and hopefully give you something great to think about. So always seek the advice of your physicians. So with that, we're going to get started. And I have the honor of the first question, and it's coming to you, Andrew. So Andrew, right off the top, maybe not everyone's heard of Live Chair Health. So tell us about Live Chair Health. Tell us about yourself and what prompted you to start this company and what the company is about.
Yeah, no, it's a pleasure to be here, and thanks for having me and Dr. Noble. So Live Chair Health builds networks of clinical and non-clinical resources like barbershops, hair salons, and churches to address minority health disparities by accessing, engaging, and reaching hard-to-reach populations. Take a wide variety of coordinated health-oriented actions, ranging from connecting to health insurance, ensuring that those clients have a primary care provider, and then raising awareness about chronic diseases such as hypertension, which is what this project is focused on. And so how do we get started? Live Chair Health actually was Live Chair, and we began as a scheduling and payment processing platform in 2017. And so as the business was growing, we grew our product to about 27 states with over 20,000 users on the platform. And then unfortunately, as our business was growing, my dad's health was declining. And so in 2018, my co-founders and I began to research, and not having that healthcare background, either by clinical training or academic background, we didn't realize there was such a gaping hole between the general population and ethnic minorities in terms of health disparities. And so as we were looking at our data, and we were also looking at the problem that the health system had a hard time reaching this population, we basically had an epiphany, and we said, why not use the barbershop and hair salons as an access point? And ever since then, we haven't looked back. And so that's who we are. That's a little bit of our evolution and some of the things that we're focused on.
That's great. And I think, this being Men's Health Month, it's a perfect opportunity to kind of highlight this work. And so I'm going to follow up on that a little bit, Andrew, and kind of what, when you think about this personally and some of the lessons that you've learned, we also got connected through the Black Caregiver Resource Group for Providence. And so there are, that shift from the model of, scheduling to one really focused on healthcare. Tell us what that was like, because I think there are a lot of lessons there for the caregivers that are listening, for the general public. How does one make that shift? And it seems like a shift that came out of your heart because of your family's experience. Tell us a little bit more about that.
Yeah, investors always ask me, like, if you're having so much traction with the scheduling and booking business, like why make the pivot? And so when you see your father struggling to live, and then you also see how my situation is not an anomaly, it becomes very clear why you would make a pivot. And so we have an amazing opportunity at Live Chair Health to do well by doing good and helping people live a more flourishing life. And so, as you can imagine, coming from business management software into healthcare, they are diametrically different. There's an entire world that I was not aware of. And so I think just surrounding ourselves with people like Dr. Noble to give us that clinical advice, and then also people with deep healthcare experience, like some of our advisors, has really helped out, right? Learning things like HIPAA and referrals and how contracting work. I mean, it is a process like no other. So that's kind of like what some of the things we've learned is that healthcare is very hard. It takes a long time to get people to realize that your solution can be valuable. And so we're really excited to make a foray into healthcare and show that additional or untraditional models of access need to be integrated into the healthcare system if we want to make healthcare more equitable for all.
That's great. So let's get even more specific because obviously you've shared that you have gotten a foothold in this new business model on the East Coast, and we're really proud to be your first West Coast partner and want to share a little bit more about the work that we're going to be doing together. And so maybe could you speak to that just very practically? So, what is it going to look like in Southern California? How does it actually work? I think folks will be really excited to hear about that.
Yeah, absolutely. So when we recruit community liaisons, barbershop salons, and we're also working with some churches, we have training. So training on the Live Your Health program, training on what the community liaison's role in this program or in our product is. And so after that training is conducted, we set up a kiosk station in the shop so that when clients are either being sent to the shop from Providence or we have organic traffic through the shop, clients can participate in our health risk assessment. Once that health risk assessment is completed, we create a customized health journey for each client that starts from ensuring that someone has health insurance, connecting them to a primary care provider, and then periodically we have our staff, and in addition to some of the barbers and stylists are also trained or will be trained on taking blood pressure, which is a huge focus of this project. And once that screening is conducted, clients are able to log their biometrics of their blood pressure in the app and then track and get access to content and also nudges from our technology. And so that's fundamentally like how it works. Obviously, there's some more nuts and bolts. Like we also have our health coaches that will talk with the clients and create a custom plan as well. So we're really excited to, what we did on the East Coast is more clinical, non-clinical, very clerical member engagement. We're excited to kind of itch more towards that clinical alongside Providence Health. And then we'll be rolling out our like holistic hypertension model, which I know Dr. Noble will talk about later in this presentation.
That's great. Yeah, I know we have Jeremy and I and our team we're hoping to impact more than 100,000 people with our reduction in hypertension project. And so you will be critical to that, and building off of the trust of barbershops and salons and churches is absolutely the right way, and love how you operationalize that. I'm going to turn it over to my partner in crime, Jeremy Elkins, for the next question.
Perfect. Thanks, Kenya. Dr. Noble, we've had the opportunity to hear a little bit about Andrew's journey. Can you tell us a little bit about your story, how you became a physician and how you became connected to LiveChair Health?
Appreciate it, Jeremy, and thank you, Kenya and Providence Health for allowing Andrew and I to be here today. It's an honor and a pleasure. So my journey to medicine and LiveChair Health is really founded upon faith, family, and culture. So I was blessed with the gift of persistence, just sticking with the job until it was finished, blessed with a beautiful family that really cultivated that passion that I have for the human body. I can remember laying on my grandparents' living room floor, being fascinated with an encyclopedia that showed the human body. And my family just really cultivated that and fostered that. Culture was big to me. And so I was a fan of a different world growing up. And that really, that experience, that historically Black college or university experience really inspired me to go to Xavier University of Louisiana, as it was #1 at the time for putting Blacks into medical school. Went on to Indiana University for med school, and I did my general surgery training in Portland, Oregon. And it was there that I saw a seed was planted. I met my wife, who's a hairstylist, and seeing the relationship that she has with her clients, that seed of healthcare and hair care together really placed hold. And so fast forward my career in the Navy, and when I got out of the Navy, came across LiveChair Health. And as you can tell from meeting Andrew, he's just a remarkable founder, a visionary, and just great leadership. And it was really his passion and drive to decrease healthcare disparities in Black men that really compelled me to lend my full weight and effort to helping out LiveChair Health.
That's great. Thanks for that. Can you talk about what health disparities have you seen in your education and your work in medicine a little bit?
Yeah, so when you think about the healthcare disparities in medicine, I think the biggest one that stands out is just the lack of Black males in medicine and how that correlates to health in general. So Black males make up about 2% of the medical students in the United States, and that's lower than what we saw in 1978. And so that directly correlates to outcomes that we see with Black men. And as Kenya pointed out, June is Men's Health Awareness Month. And so when we look at prostate cancer, we find that there's disparities there. 50% of Black men are 55% more likely to develop prostate cancer in their life, and 55% more likely to die from early disease. So when we look at prostate cancer, cardiovascular disease, lung cancer, we see these great disparities, and that just plays out, and a lot of it is tied to some factors that we'll talk about later.
Yeah, thanks for talking about the focus in June. Statistics show that African Americans are disproportionately affected by poor health outcomes due to a number of different factors. What tools are built into the LifeChair Health app that can help improve the health of this community?
Yeah, so when we look at the healthcare disparities, I think we got to take note of the fact that the reason why the healthcare disparities exist is because of intentional systemic issues, largely due to racism. And so to combat that, those intentional forces that really decrease individuals' ability for equitable health, those things being those what we call the social determinants of health: education, food security, housing security, the neighborhood, economic resources. So we at LifeChair Health, we're just as intentional in trying to combat those things. So what we have featured in our app is content that is curated by the Black healthcare professionals that Andrew alluded to earlier, the Brain Trust. We go through and curate this content so that it not only educates the reader, but empowers them and motivates them to move, because we know that taking action in your healthcare journey is important. The other thing is trust. And so we have tools within how individuals come to LifeChair Health is through the trusted relationship that they have with their barber, their stylist, and the church. So that trust is very important into what we do. And so what we try to feature on the app are articles that really allow individuals to have a great relationship with their physician, just like they do with their stylist or barber. So articles on how do you cultivate that relationship? What are some of the tips to having a good visit at the doctor? What are some tips in regards to diet? And then in regards to being able to log your vitals, your blood pressure in the app, and being able to log your medications, all those things such that when you go to the doctor's office, you don't have to bring your whole medicine cabinet or your whole pill bottles. You can just use the app to help you facilitate that visit. So we try to be as intentional as the systemic issues that are out there really causing those disparities.
Yeah, that's great. Thank you. So speaking of disparities, there are folks in the community who are still very worried about getting the COVID-19 vaccine. What can you share with our listeners who have reservations about receiving the vaccine?
Well, I can say that I hear you. I was one of those providers that initially didn't get the COVID-19 vaccine until when it came out. I got the vaccine just recently in April, the 2-shot Pfizer vaccine. I wanted to see how the studies played out in real life. Understood the trial studies and things of that nature, but I wanted to see what those studies look like as individuals started to get the vaccine in the community. The second thing I can say is that we at LifeChair Health hear you. So we've had 2 crucial conversation webinars. So webinars really talking about the COVID-19 vaccine. In January, we had Dr. Alexa Gaffney, who's a triple board certified infectious disease doctor, internal medicine doctor, pediatrician, who was actually out in Long Island during the height of the pandemic. And she gave great insight into the vaccine. And then in February, we had Dr. Michelle Ogunwele, who's a board certified internal medicine physician and Johns Hopkins Healthcare Disparities Researcher, who also gave great insight onto why individuals should get the vaccine. And then I can also say that we got you at LifeChair Health. So we have partnered with our providers out in Baltimore to actually bring vaccinations to the shop. And so we've vaccinated more than 50 individuals at this point in time, ensuring that they've got the full complement of vaccines in some of the hardest hit places in Baltimore. So we partner with the Maryland Department of Health and other institutions to really provide the vaccine. So I hear you, we hear you, and at LifeChair Health, we got you.
And I just want to make one clarification. I think we're up to about like 200 now. So yeah, and about 6 of them. So just
nice.
Perfect. Well, thanks for sharing. Kenya, I'm going to turn it back to you.
Yeah. So, I mean, first of all, I've spent some time on the app. I was kind of an app interloper early on, where I was like, and it's beautiful. It's such a great user interface. Like, it's fun to use. I know you can track your mindfulness, and that's super important to both of you as well, is to make sure that behavioral health and mental health is a part of this. So let's dig into a little bit more. I mean, obviously, I think a lot of people have heard of the barbershop research that happened around 20 years ago, actually out of Los Angeles. And then, we haven't seen a lot since then, although people are excited about it. I think, you're the first to really say, we're going to operationalize this into a business, and you've built on the trust of already proving yourselves through your scheduling. So, that theme of trust upon trust upon trust, and now you're pivoting it for the well-being of our communities. So, Andrew, looking to you, I'd love to hear a little bit more about why barbershops and salons as that source of healthcare. Like, I mean, it's, if someone were to drop from Mars, it wouldn't be obvious, right? So tell us a little bit more about why that's the right place to really make an impact. And then also, how can a local barbershop out here in California, and I know you'll be here soon, so I'm excited to actually get to hug you and see you in real life. How can a local barbershop become a part of this network?
Yeah, no, that's a great question. So the first question, like, why barbershops and hair salons? Well, when you think about the reasons why African Americans and other ethnic minorities have not engaged the system, it's distrust. That's number one. And then two, you have, I don't think there's a culturally sensitive way that providers in the health system engages with communities, right? And I think that's for all people, to be honest with you, right? When you have someone that goes to the doctor and it's like, just eat more kale, like, that's not going to encourage anyone, right, with that message. So Box Share Health, kale is good. I like kale too, by the way. But you gotta encourage people more. You got to explain the why more than just like what you should be doing. Yeah, explain the why more. And I think the barbershops and hair salon give us an amazing opportunity to explain that why from a trusted source. And so when you also think about how many people get as close to your personal space, it's probably only two, like your significant other, your barber, your stylist, and I don't know, maybe your mother, right? Mother or father. And so you build, because of that trust, it allows you to have like deep conversations. And a lot of these relationships are long tenured. And so what we first start off by doing when we launch any market is train and get the barbers and the stylists to take care of their health care first. Because if they take care of their health, then they're more willing to be an advocate. So we ensure that they have health insurance, that they have been connected to a primary care provider, and that they're getting screened, and then also being able to manage those chronic diseases. So then once they're communicating that to the clients, it's just like second nature. So the first thing, the first reason why, or the first question why, it's because of the trust. And because the access point, there's not too many venues where there's a huge congregation of people, and no pun intended, because that's definitely what's true at the churches, of people in one location. And so in terms of reaching more folks, I think it's a great access point. The second question is, slipped my mind. The second question.
Yeah, how can a barbershop kind of get into the network? How, if they're interested in kind of employing the technology into their own barbershop, how do they do that?
Yeah, so on our website, livechair.co, we actually have a tab that says work with us. And if you complete that work with us, you'll be getting contacted by me and some of our other field operators that'll get you set up. So one will explain more about the program, the incentives that are involved, because speaking to your statement around how barbershop and hair salon initiatives have been around for 40 years, one of the things that we wanted to do to make sure this is sustained is create a business model and an operational model behind it. Because almost every medical journal has written about how efficacious that this model would be in driving down health disparities and reducing blood pressure, et cetera, et cetera. But in terms of, once the research is done, someone's off to like their next project, and like the program fades away. And so one of the things that was important to us is the sustainability, so that we can fund our hair professionals, and also incentivize them from a financial standpoint, because they are hair professionals at the end of the day. They're entrepreneurs. That's how they make their living. And we're not asking them to do a ton of the heavy lifting. We're asking them to be a sound voice and be a trusted voice. And then Live Chair Health, through our staff and our technology, we can take the baton and finish the race.
Man, that could be a whole nother podcast, because that's pretty exciting. Because what you're saying is really that, in the past, it doesn't have to be that something that is good for the community is off to the side, is the frosting, is, kind of waiting on one grant after another. If
Right.
it's proven to make a difference, we should put the strength of capitalism into it and
Right.
make this available and blow this up. And there's some kind of, judgment that we put on things about which venue, certain activities are allowed to exist in. And so what I love about our partnership is, we're the largest provider of healthcare in Southern California, and we're nonprofit in our core and our mission, and see you as a critical partner for expanding that mission, and are supportive of this, Black-owned startup that, HBCU grads, all the things. And so we're so excited to be partnering with you. I got to stop. That's not even the end. That feels like the end. It's not the end. So I'm going to stop there and ask you another question, which is related. How can the audience find a live chair barber? Is it also on your website?
Yeah, so we currently we don't have our network of shops. It's interesting that you bring that up, because we're building that network of shops as we're onboarded in more states. We get a lot of people asking, "Hey, I want to go to a live chair health barber so they can participate in the program." So we are actively building out that network of shops in Maryland. Also, we just launched in Greensboro, North Carolina, and then we're launching in California. And so we're excited about that. I did want to mention one other thing on the last question. One of the great things about capitalism and utilizing capitalism is the earnings and the revenue that we make. We're pouring that money back into those same communities. So in terms of giving the barbers and the stylists, extra income by helping their clients look and feel good, like everyone is getting a piece of the pie. Also with the clients, because there are incentives for clients to participate in the program as well, whether it's reducing your blood pressure, ensuring that you go to a primary care provider. And we have a great currency in that of hair services where, hey, get your blood pressure checked, lower your blood pressure. Next time you come in, you might have a reward or discount or a free haircut based on, you hitting some metrics. So utilizing that capital back into the ecosystem that we're serving, I think is advantageous for everyone. And it's beneficial for everyone.
Those incentives are a great idea. Jeremy, you're up next, brother.
Perfect. So Dr. Noble, we're getting a little short on time. So I have a question for you. How can we protect ourselves from having to see you in the OR? What is some practical advice you have for us regarding heart health?
That's a great question, Jeremy. The answer is pretty simple. Exercise. So you want to exercise 3 to 5 times a week. You want to get that heart rate up. And one of the days of the week, you definitely want to try to get some moderate strength training. The second thing is moderation. I'm not one that believes in in diets. I just think that, you can eat what you like in moderation, but don't overindulge in one thing or another. So, wine is fine, but don't overindulge in it. Chocolate is fine, don't overindulge. I am adamant about not smoking. Smoking cessation is key to preventing lung cancer. And then the final thing is enjoy life. Life is short, and everyone that I see in the hospital, they're not talking about I should have worked more, or I should have did this, or I should have did that. They're talking about the time they should have spent with their family, the vacations that they wanted to do, all those bucket list sort of activities. So exercise, moderation, everything in moderation, and then enjoying life, because life is short.
That's great. Coming from a large Italian family, I appreciate the call out to wine specifically. That's very important. I like that. Would you describe for us live chair health 10 years from now? What do you hope the community will be doing then? Or I'm sorry, the company will be doing then?
Wow, that's a great question. So I think that 10 years from now, I would suspect that live chair health looks and feels like Shuri's Lab in Black Panther, in which health is sexy, it's innovative, and it's seamlessly tied into everything that we do on a day-to-day basis, and it's perceived as something that's cool and positive to be healthy, because I do believe that health is wealth. I see that being able to collect data at the live chair health barbershops and being able to use that zip code data to give personalized community care right there, because what we're finding in Baltimore, Maryland is going to be dramatically different in Los Angeles and the greater Los Angeles area. So getting that zip code specific data to impact health is very key. And I think that partnering with local governments is and other institutions is also key. But at the end of the day, I think that live chair health, my hope and prayer is that it's going to be ubiquitous with health and health that is seamless with everyday life.
That's great.
So we have a couple of minutes. It's gone by so fast, but Andrew, kind of reflecting back on, and I know you're kind of right at the, the middle of the beginning, if you will. And that's what's so neat is we're exposing people to a company as it's, you're still growing in that growing stage. But I mean, man, I would love to hear just a little bit about what you've learned about health, personal relationships, and just this journey as you've launched Live Chair Health.
Well, it takes a team, and I don't want to say like common parlance stuff, but like it's true. It takes a team, especially given the complexity of healthcare. So there's one thing of being a business person, right? There's another thing of being a healthcare person, right? And it's just two completely different worlds. So I've been able to lean on and get my arms lifted up by my advisory group. The Brain Trust has been extremely helpful for helping us understand like some of the clinical aspects. And then also other learnings. I think patience, right? To your point, Kenya, we are still like, we're not Google. We're not, this 20-year-old, company or 25-year-old company that's been around and like well-known name, and the machine just, it hums. We're a startup, but we have some bumps and bruises. But every day the team wakes up and knows like what we're aiming for, what we're building. And so a lot of times when I'm in these investor conversations, they can't box us in. Right? They don't have a reference. Oh, you're not X for Y. It's like, yeah, but I'm building the next Google. So Google 25 years ago, it was search. What's search? We have Wikipedia. We have, we go to the library and look at books, right? And so that's when you're building something transformational, it takes time. I don't have all the answers. Like, I'm sorry, I don't have infinite wisdom. But what I do know is I'm relentless. My team is relentless, and we have a passion to reduce health disparities and make healthcare more equitable for all. And if we just keep that at the forefront in our North Star, or as our North Star, while also, I don't know if business people are looking at the data and the numbers and make sure we hit our KPIs, we're going to achieve incredible things.
Well, I think it's great reflection. And, I think from Providence's perspective, what's really exciting about working with you is that, the relationship started from a relationship, right? Started from a caregiver, an employee who trusted us enough to extend the relationship to you. And then and we had these great conversations. So the theme for all of this is trust. It's trust in the healthcare provider. It's trust in your barbershop or salon. It's trust in the app. And, all of these things and all of health equity, we know is fundamentally comes down to trust. And so you are doing a tremendous job at really helping operationalizing that trust into better healthcare outcomes. And spending time with you today has been such a joy. Jeremy, always wonderful to be with you as we work together on this health equity journey. And we have a couple of questions in the Q&A that I don't think we'll be able to get to today, but we can follow up on. Really great questions around data, security. It is around extending into high schools. Sure, why not? Let's do it. And then also to reinforce that Live Chair, though our project is focused on reducing hypertension in the Black communities in Los Angeles, they have a vision that is, very big and, for all communities. Right. And not just hypertension, really extending far into chronic diseases and other conditions that affect our communities, wherever the health disparities may be. So I'll land it there. I want to thank everyone for being with us today, and take care, be well, and thank you, Live Chair team.
Thank you. Thanks for having me.
Thanks, everyone. Bye-bye.